This video is going to be especially useful for people who are suffering with ongoing groin tightness and pain and possibly some pinching in their hip. Okay, a lot of the time pinching in your hip is more to do with the position that you're in rather than an actual structural pathology, even though a lot of the advice that's given is that you need to get an operation or there's an actual genuine issue with your hip. A lot of the time that's not the case. It's more often a case that it's to do with the position of our pelvis. Because of the natural asymmetries in our body, our left and right side aren't exactly the same. Oftentimes, not all the time, but oftentimes, our pelvis can be a little bit tilted on the left in this position here. Now, this can mean that some muscles are chronically overactive, as in they're always working, doing too much, they're overloaded, and then other muscles aren't doing what they're supposed to be doing at all. In this particular example here, getting right-sided groin pain in here is often a result of your pelvis being in this position. The answer to that, as opposed to squeezing a ball in between your knees and overload an already overloaded muscle, is to try and get your pelvis back into this position, restore that proper position there, and that will unload and create a little bit more space here so you have less pinching. So for example, in the exercise we're about to go through now, which is from the Postural Restoration Institute, we're going to try and activate the opposite groin and your glute medius on the left hand side to bring your pelvis back here and unload this position. Again, we're going to do the breathing during the exercise. We'll take a look at it now. So set yourself up close to the wall here. Just get yourself a little bit more forward. So you're going to be in this 90-90 position between your hips and your knees. You put a foam roller or a ball or a rolled up towel, something about 4 to 6 inches in between your ankles here. You want to make sure that your hip is on top of your other hip and that your shoulder is packed around into this position as well. If there was a point here and here, just bring those a little bit closer together so there's a small bit of abdominal activity here on the left hand side. As always, you're going to breathe in through your nose for 2 seconds, breathe out through your mouth for 6 seconds, pause and then go again. Now in this position here, when you breathe in, you want to apply backward pressure with this top leg, with your left leg here. So let's breathe in through your nose and you're pulling back to bring this leg back that little bit. So it's almost like you're sucking your leg back into your socket. And as you breathe out, you're bringing this down towards the opposite side. Going to keep this foot against the wall in the same position. Breathe in, pull your foot back. And as you breathe out, bringing this down towards the opposite knee. So where you should feel this is on the inside of your left groin and the outside of your left hip. Do 4 to 5 reps of that. That generally restores pelvic position and unloads the tight groin on your right hand side.